Today is World Hearing Day, a campaign held each year by the Office of the Prevention of Blindness and Deafness of the World Health Organization. The day highlights timely and effective interventions which can ensure that people with hearing loss are able to achieve a good quality life. The day also uses evidence-based interventions to bring innovation into the space. Bronwyn Van Wyk is the head of audiology at Specsavers, and she joins us now to expand the conversation. A very good evening to you. Thank you so much for your time. As we try and make sense and gain a better understanding of the significance of World Hearing Day, what are the types of hearing loss? How best can one understand it?
Definitely. I think it's a very prominent question, especially today as we celebrate World Hearing Day with the theme of changing mindsets, educating around hearing and hearing health. In terms of different types of hearing loss, your ear is a beautiful organ made up of lots of different pieces. And if one of those pieces are struggling, then you're going to struggle with hearing. It could be that there's a wax plug in your ear, or there's an issue with the middle ear bones, or the issues deeper in the cochlea. But I think the most important thing is to always be tested regularly. You know, we check our eyes, we check our blood pressure, and this World Hearing Day, go check your ears as well.
Hearing loss has been described as common, but often under-recognized in terms of, health issues. What are the causes of hearing loss? Is it age-specific?
It is age-specific, so aging does contribute to hearing loss. But these days, we live in a very noisy environment. I think we are using sort of iPods and personal listening devices more than ever before. And so the average age of hearing loss is getting younger and younger. In America, the studies are showing us that 1 in 5 teenagers now has a hearing loss. So this idea and the stigma associated with hearing only being linked to older people is definitely changing.
And in terms of the common thread, would you say hearing loss is just an inconvenience? Does it link to other risks?
It definitely does link to other risks. There's been a lot of research in this field of hearing loss, because if you're looking after your hearing, you're not just looking after your hearing, but also your brain. So there's lots of research studies to show that untreated hearing loss can lead to a higher risk of dementia. We also know that hearing loss can lead to withdrawal, isolation, because it's just so difficult to hear in social situations and it's awkward. So people tend to withdraw, which can also lead to loneliness.
You've mentioned that hearing loss is now affecting patients who are much younger than before. What would you say are some of the more common early indicators of hearing loss?
I think that's an important question, because with hearing loss, you usually lose your hearing little bits at a time. So that makes it difficult to kind of recognize those early signs. But if you're turning the TV volume up that your neighbors can, benefit from not even putting on their TV volume, or if you're struggling to hear speech in the presence of background noise, like you're missing out on conversation in a restaurant, if you're struggling to hear over the phone, or you kind of find yourself asking for repetition a lot, then it's definitely time to have a hearing test and see what's going on.
Yeah. And there's also a concern about affordability. I mean, I know there's a lot of advancements around hearing aid, but it can be quite pricey. How does the general public access hearing aids without breaking the bank?
Definitely. So affordability is definitely a factor, but there are affordable options out there. Most medical aids do have benefits, and there's also payment plans out there that you can use to fund hearing aids as well.
Very well. Thank you so much for speaking to us this evening. Wrapping up that conversation with Bronwyn Van Wyk, who is the head of audiology at Specsavers, joining us to expand on today being World Hearing Day.